CREST syndrome is a type of limited scleroderma, a chronic disease that makes the skin and some internal organs harder than normal. The name CREST stands for 5 main problems that often appear together: calcinosis, Raynaud's phenomenon, esophageal trouble, sclerodactyly, and telangiectasia. Think of it like a set of clues that doctors use to recognize the illness, much like spotting the pieces of a puzzle on a patient's body. The exact cause of CREST syndrome is not known, but it is believed to involve a mix of genetics and the immune system. Some people inherit genes that make their immune system more likely to attack their own tissues. Environmental triggers such as infections, certain chemicals, or stress can set off this mistaken attack, leading to inflammation and the buildup of collagen, the material that makes skin stiff. Imagine a security system that mistakes friendly neighbors for burglars and starts locking down the house. Calcinosis, small calcium deposits under the skin that feel like hard bumps, similar to tiny stones. Raynaud's phenomenon, fingers and toes turn white, then blue, then red when exposed to cold or stress, like a traffic light changing colors. Esophageal problems, trouble swallowing or feeling of food sticking, as if the food pipe is too tight. Sclerodactyly, skin on the fingers and toes becomes thick and tight, making a hand look like a glove. Telangiectasia, tiny red spider-like blood vessels appear on the face or hands. Patients may also feel fatigue, joint pain, or mild breathing issues if lungs are involved. Doctors diagnose CREST by looking at the characteristic signs, asking about medical history, and running tests. Blood tests for specific antibodies, anti-centromere antibodies, that act like a fingerprint for the disease. Imaging, X-ray, or ultrasound to see calcium deposits or lung changes. Tests that check how well the esophagus works, such as a barium swallow. Treatment focuses on managing each symptom. Raynaud's keep warm, avoid stress, and sometimes use medicines that widen blood vessels. Esophageal, diet changes, proton pump inhibitors, or swallowing therapy. Skin tightness, physical therapy, and in some cases, drugs that slow collagen buildup. Regular follow-up with a rheumatologist helps adjust treatment as the disease changes. Because the exact cause is unknown, you cannot completely prevent CREST, but you can lower the risk of worsening symptoms. Avoid cold exposure and sudden temperature changes. Wear gloves, warm socks. Stop smoking, which makes blood vessels tighter. Manage stress with relaxation techniques, deep breathing, yoga. Keep a balanced diet rich in antioxidants to support overall immune health. Stay active with gentle exercises to maintain joint flexibility and circulation. Targeted biologic therapies, such as nintedanib, which have shown promise in slowing lung fibrosis in scleroderma patients. Genetic studies that are identifying new DN, markers linked to higher disease risk, helping doctors predict who might develop CREST. Digital monitoring tools, wearable devices that track temperature changes in fingers, can alert patients early to Raynaud attacks.